Morning to everyone. So my name is Nick from Malaysia. So I'm representative from the University Technical Malaysia Melaka. So we are located at Melaka, the historical city of Malaysia, similar to Kyoto and rest of the world. So I'm representative from the sixth author for this paper. So we call our paper a preliminary study on vowel recognition via CNN for disordered people in Malay language. Okay, so I will be talking about this listed items: introduction, research problem, objective, related works, dataset arrangement, experiment setting, result, and finally I will be concluding my presentation. So let me introduce our research at a glance. So basically, if you take a look at the right-hand corner of the graph, we can see that the projection of the non-commutable disease has been increased from 1990 to 2020. So it shows that the numbers of patients involved in disease has been increased quite large in terms of the number. So from these matters, basically we could consider that the all infected people or patient could be described as disordered people, which facing a difficulty to get back their ability after they gain or having the kind of disease. Okay, so speaking of the disability, we have several types of disability that we have in to extent of our knowledge. So we have speech, eyes, hearing, and so on. So this research focusing on the speech ability. So whereby in speech ability, we can conclude that we have the most important item will be vowel, followed by consonant, syllabus, phrase, and sentences. So that's the reason why we hope that we try to start our journey from the vowel, and later on we'll be hoping to get to the sentences in future. So in general, patients should attend the rehabilitation session is a common for us in the in Malaysia. Hopefully the same as the whole world. So basically in Malaysia, we have Pekeso, the place that we give the services for rehab for those who are affected by the stroke disease. Okay. So far, the rehab session was conducted by manually, and it demanding times and human power to conduct all the session and exercises for the patient. So plus, again, in Malaysia lately, as the COVID-19 happened in worldwide, so yes, people getting a pressure life and high blood pressure and stroke become one of our silent killer disease in our country. So in terms of the problem, basically we look up several problems that we have. Still, we are facing the listen and evaluate assessment happen in our rehab center called Perkeso. And currently in Perkeso, we still don't have the intelligence system for giving the rehab exercises or the practices to the patient, and we're hoping that one day we can have a full capability of an application by using the cell phone or tablet, or even by their own patient could do it by themselves at home. So plus during COVID-19, the rehabs activities is limited, so it makes us challenge to give the service to all the patient. So plus last but not least, the problem is we still have limited Malay language vowel sound datasets publicly available in the clouds. So for that particular problem, we set our objective. We have 3 objectives to go. So first of all, we propose a way to gain the voice information instead of image. So basically, if we look at the way that the voice recognition research, we are focusing on the wave files, whereby we have X and Y information. So we bring that particular information to be available in the image processing, which are considering as an image pixel. So that's the reason why we utilize the spectrogram image over here. So, and then obviously, by this paper, we introduced a new Malay language vowel datasets, REUAO, with the mixed male and female subject, which consists 3 lengths of each vowel with signal. So later on, I'll be explaining about this. And lastly, we will show the proposed dataset images are comparable and acceptable in recognizing the vowel correctly via CNN, convolution neural network. So in the past few years, basically, we already checked and studied several articles about the rehab activities and rehab exercises happen in whole around the world. So the first 2 was conducted manually. Basically, the articulation disorder is one of the types of speech disorder. So that will be conducted still in manually, while the Van Piper et al. And others proposed the articulate drills and motors, which conducting the tongue movement, still also considering as the manual rehab. And then lastly, in recent years, we oftenly hear about CNN has been used in classification activities, which we can easily see that the fruit classification and many more classification has been involved in this particular field. So for that, we think that we can fill up the information and our expertise to this particular CNN from the voice point of view, meaning with signal. So to do this, basically, we have to create our own datasets from recording a, e, u, e, o, the 5 vowels in our hand. So basically, as I mentioned before, we recorded from nine sample person, mixed gender, male and female, and we transform it to a, e, u, e, o in spectrogram image. So obviously, this is representing this one in terms of image. So then we create our own data set and we split it into 2. The first will be the training and later will be the validations images. So how we do it basically, as I mentioned in the objective, we put it in 3 characteristics of wave signal, which is a short arc, a middle arc, and long arc. In a way that short will be a, middle arc will be a, and long will be kind of. Okay, so these are the sample from the 3%, the 3 types of arc for person number 1, 2, and 3, while the bottom one is e, u, e, o from the same person. So this is e, this is u, this is e, and while this is o. Right? Okay. So speaking of the experiment setting, basically we still classify the vowel for 5 categories or 5 classes, a, e, u, e, o. Obviously, this is still one more vowel to go because in Malay language, we have double E voice. So still we don't have that one and we are working on that. And yes, we use the simple network that we built, just a matter of to show that the dataset is appropriate to be used, comparing to the VGG 16, 19, and ResNet. Okay, regarding to the result and discussion, based on the batches size that we choose, from 5 to 20, basically the validation of batch size 10 shows the 73.56 in percentage for the accuracy. And if you take a look on the epoch size 50 will be the first in rank, 76.59%. So, and then lastly, we take a look at the comparison between our simple proposed network design with VGG 16, 19, and ResNet 50. So in this particular experiment setting, we use batch 50 and several epochs number. So for this particular comparison result, we managed to show that our validation accuracy is 73.04, which considerable comparable to the 3 network model over here. Okay, last but not least, I will be concluding my presentation. So the paper delivered a systematic intelligent rehab activities friendly to be used for in the future. So basically, this is still the preliminary study, as I mentioned earlier in the topics, but we will have several tasks to be done for giving our best to the Per Queso Rehab Center. So we recorded a new dataset, which is including 5 types of vowel, A, E, I, O, U, and trained the post-converted spectrogram input using the CNN. And this paper simple CNN architecture network successfully classified the vowel for about 73.04, as I mentioned earlier, and could later be used to recognize vowel from disordered people, or likewise we can describe as the stroke patient. So for future work, basically we are looking forward to add up our data sets to the multiple types of E, as I mentioned before, because in Malay we have E and A. So that would be one. And the other one is noise added wave signal could also be considered in future, as it is considering important in observing the network reliability in many aspects and conditions during the experimental is being done. I think that's all for me. Thank you.
Thank you for